Welcome to EVAC, or the Evacuation of Vulnerable and Critical Patients Didactics module, where you will learn how to safely evacuate a critically ill patient in the setting of an environmental emergency, such as an earthquake. Learning objectives include understanding the chain of command for emergencies, understanding the flow of information to and from the bedside, understanding the high priority equipment to prepare for evacuating a critically ill patient, and discussing communication techniques and patient safety tool use in emergent situations. By the end of this training, we hope that you will be able to expediently prepare a patient for evacuation by completing the steps necessary to assess, secure, and prepare a patient for evacuation. How do you define a chain of command in your setting? On a unit level, it is typically the charge nurse who takes the role of an area leader, or AL. On a hospital level, the Emergency Operations Center, or EOC, orchestrates hospital emergency response. When is patient evacuation necessary in an emergency? Generally, when the threat of staying outweighs the risk of transferring an unstable patient. Of note, this order typically comes from the EOC in the form of the charge nurse. Remember, unless there is immediate danger to yourself or the patient, such as falling debris or fire, wait for the order to evacuate. During an earthquake, drop, cover, and hold on whenever you feel shaking. Immediately after an earthquake, assess yourself for safety first. Then, assess others for safety, that is, your patients. Then assess for structural hazards such as an unstable building, debris, gas leaks, fires, etc. Once you've received the order to evacuate, or you have determined that there is an imminent threat requiring immediate evacuation, you need to prepare your patient. Unplug or unhook all non-essential care devices. Assess medication statuses, such as if they can be pushed to complete, paused, or drawn up to transport. Remember to consider the weather outside, so think about bringing blankets or hats. What equipment needs to be prioritized in a disaster-mediated patient evacuation? We surveyed experienced charge nurses from the Seattle Children's Neonatal ICU and Emergency Department to create an equipment prioritization list of packing items for critically ill patients, such as a septic intubated neonate. Keep in mind that this is just a guide and may need to be modified depending on the situation. Highly necessary items include a face mask 4 bag, a self-inflating bag, a portable oxygen tank, a weight-based code medication sheet, syringes full of necessary medications or fluids running on a pump, a patient ID tag or label, and a pen or marker. Fairly essential items include IV pumps, physical chart, gloves, hand sanitizer, saline flushes, extra blankets or linens, alcohol or IV sterilization wipes, and a blank code documentation sheet. Fairly non-essential items identified were a hat, a flashlight or pen light, nursing handoff or sign-out sheet, scissors, a roll of tape, a CO2 detector, ventilator, and empty syringes. And lastly, non-essential equipment that was felt to be more likely to delay evacuation than to be helpful included caps of IV lines, face masks for staff, portable suction for Repogal clamp, extra diapers, a pacifier, baby wipes, equipment cleaning wipes, a measuring tape, sterile glucose water, Pedialyte or oral electrolyte solution, ready-to-feed formula, and a breast pump for the mother. The different types of communication tools that you might use in disaster include SBAR, or Situation, Background, Assessment, Recommendation, QVV, or Qualify, Validate, Verify, Stop and Resolve, STAR, or Stop, Think, Act, review. A specific example of using a communication tool like SBAR is if you are asked about your status. You might structure your communication to include the status of your room and patient and provide an assessment. Your recommendation could include information about whether you believe it is safe to remain in your room or if immediate evacuation appears necessary. Remember to use communication tools such as stop and resolve. For example, double-checking an ID band or turning off a running faucet. Use QVV when you need to assess whether the information you are receiving is complete or correct. Closed-loop communication is essential in an emergency situation. An example of this is if you are told by the charge nurse that it is your turn to evacuate. You could respond, "I am evacuating my patient now." What about families? As usual, maintain open, clear, and simple communication. It's important to stay calm and maintain situational awareness. If the family is at bedside, assess if they can help or if they are hurt. Think about how to contact the family if they are not at bedside. Seattle is at risk for earthquake secondary to its location, but this evacuation didactic training can apply to patient evacuation in any disaster-related scenario. If you have any question, please ask facilitators.